Hey guys, Shauna here. Oh man, what a day. So I just finished up in clinic. COVID updates. So I never expected life to change this quickly, this drastically. Canceled conferences are one thing, but this is really changing the way I practice medicine. It's kind of funny because I never thought of medicine as a non-essential service, but what I'm seeing with specialists, what I'm seeing with my own practice is we're deferring a lot of what we can to the best of our abilities to be managed via phone. So I'm doing a lot of telephone triage, and it really makes me appreciate how much information I get in a patient visit. So, just from body language, from the physical exam, and how much uncertainty there is, and how much more hedging I have to do with a telephone consult. Maybe this will change with telehealth consults when I have video abilities, but it's definitely not something I envisioned starting 2020 with. And then just the information, the ever changing information on COVID-19. So, ibuprofen, what's the stance on that? Is it safe to take? Is it not? I saw the WHO had just initially advised against taking ibuprofen in the context of COVID-19, but then reversed the stance. And then I saw a BMJ article that cited multiple infectious disease and virology and immunology experts saying, yeah, it could probably possibly dampen the the system's immune response to COVID-19. But then I looked at the Harvard COVID site, and they said, it's probably okay to take if you can preferentially take Tylenol instead of ibuprofen. Do that first, but if you can't, take ibuprofen if you need to. So there's so much conflicting information with the spread of COVID. We were initially saying, okay, just wash your hands, limit contact with people, socially distance, and that all still holds. But now we're also seeing that unlike its predecessor, SARS-CoV, coronavirus 1, which is responsible for the SARS virus, SARS epidemic, that SARS-CoV-2, which causes COVID-19, can unfortunately hang around as aerosolized particles for up to 3 hours after being airborne, and hang around on surfaces for hours to days, depending on what the surface in question is. So plastics 2 to 3 days, cardboard up to 24 hours. So there's a lot of new emerging information, and in the meantime, unfortunately, COVID keeps becoming more rampant and prevalent. So I've been tracking the numbers here in Canada daily. It's kind of my morning ritual to log into the Government of Canada COVID site, and what I've seen since last Thursday: 100 cases, moved to 200, then 300. We're up to 721 cases as of this morning, so in a week's time. So that really is exponential spread. That is a barrage of information, and there's more coming. My homework tonight is to be looking at some initial sources themselves. I want to look at the Imperial College paper, citing what the projections are for the toll of the global pandemic in terms of numbers, and what that means with intervention, without intervention, and with limited intervention. So I've read the summaries of the paper, but I want to read the papers themselves before I disseminate that information. So anyways, I promised you lots of updates from me. You're gonna get them. It's gonna be COVID to start, but hopefully some more fun stuff like space medicine down the road. But the reason I'm doing this is just I realize there's people out there who really don't believe we're in the middle of a global pandemic right now, and let me tell you, we are, and it's changed the way that we're practicing life, and it needs to. We need to do everything we can to minimize the spread of COVID, protect the vulnerable, and protect our healthcare system capacity and resources. And if I can do that by helping spread information as well as the reality of the situation, you better believe I can. So that's today's update. I'm headed off to do some rural ER for the next week, so you'll be seeing me in the middle of nowhere, still within 2 hours of home. So traveling, not traveling, but That's all you got from me for today. Send along your questions, COVID 2019 or otherwise, and stay safe, stay distanced, wash your hands, wipe things down compulsively. I know I am. And I know this sounds counterintuitive. Don't panic. We're all in this together, even if we're socially distanced while doing it. Till next time.